Hi, and welcome to this video. In this video, I'd like to take a look at where the world is heading with the coronavirus, COVID-19. And for that, I will go back to the model that I introduced in my first video. This model that you see here, the code is over here, implemented in MATLAB or in GNU Octave. Now what I'm going to do today is I'm going to apply this model to the real data in the world. For that, I can use the information on this website, worldometers.info. It's a very useful website, gives you all the data. For instance, total cases of coronavirus outside of China. You can find the data on any country in the world that publishes data on coronavirus cases, coronavirus deaths, and so on. So we'll use this data to calibrate a model. Then we'll project this model into the future and see what happens. And that will give us an idea of where we're heading in terms of number of cases that we can expect in the future, number of deaths that we can expect in the future. We can run scenarios to see how delicate is the balance that we're in. Are we in danger of getting this out of control? Are we heading towards a contained virus? Things like that. So first, very quickly, a few words about the model itself. If you want to know more about the model, I suggest you either look at this paper here, archive:2003.08824, or you can take a look at my first video where I go over this model in a little more detail. Again, this is the mechanism that is assumed. People that have never been infected are infected with a certain infection rate. Infected people get sick after a while, and then sick people can either get better over time or they can get seriously sick. And seriously sick people can either get better or they die. And people who are better will eventually recover, and we assume that those people are immune. So that is the epidemiological model that the calculations here are based on. In my first video, I used some general information about things we knew about the disease to parameterize the model, and then I ran some scenarios based on that. So in this video, what I will present is some results of a calibration based on actual data, so we can evaluate what are the parameters of the disease and how are the parameters changing when you introduce some measures to contain the virus. So let me take a look. We're going to take a look at China first. And the reason for that is because we have the most information about China. China has successfully contained the virus. So they had an outbreak early on, and you can see that here in this chart. And then the outbreak got contained. So how do I model this in MATLAB? Let me show you that quickly. I have a different set of parameters that are specifically to China. So if I run the model with the variable country set to China, then the model runs these variables, and that allows me to calculate results. So I've run this model a couple of times, so a lot of times, and compared it with the actual data of the number of deaths in China as a function of time, and I came up with these variables. I came up with an infection rate of 0.46 per day, and so on. Now let's take a look at what happens. By the way, I found a success of intervention of 91%. In other words, the Chinese were able to reduce the infection rate by 91%. And so in a nutshell, they went from an R0 of 4.6 to an R0 of about 0.42. So now let's go to this file that shows some of the results. As I mentioned, the R0 was reduced from 4.6 to 0.42 on January 23, when the lockdown started in Wuhan, in the Hubei province. And as a result, this is what happened. So the number of deaths increased more or less exponentially and then started to flatten out until about 3,300 deaths were recorded recently. This is the best fitting model that I was able to generate. Now, to get good fits, I needed to make one change with respect to the original model. Here I had to assume that people who were getting better are not infecting other people. In the original model, I assumed that people who are getting better are infecting people with a lower rate of infection, but they are infecting people. Now, here, because it turns out that people are in that stage for a rather long time, it is actually not realistic to assume that they are very infectious, because if they are, the infection, the epidemic would have lasted much longer. It would have dragged out a lot more than it did. So I had to assume that these people are not infectious. So this gives us an idea of what the quality of fit is that you can expect when you're going from a disease that is out of control to a disease that goes back into control. So the blue curve is the model simulation. The orangey symbols are the reported data of the number of deaths as a function of time. Here we have an accumulated number of people that have been infected, and I had to do a scaling to get agreement between the model and the reported data, because we know that not all cases are reported. Some people, they only get mildly sick, they don't realize they have the coronavirus, they never get tested. So I had to assume that for every person who gets tested and is positively confirmed to have the coronavirus, there are a total of 2.75 people who actually have the coronavirus. In other words, 1 out of 2.75 people with coronavirus eventually get recorded in the database. And when we do that, we can see a reasonable agreement between what the model predicts and what was reported. Here it had to be assumed that people who are infected but don't show any symptoms yet were not reported yet, and it was assumed that the people who are sick are reported 7 days into their illness, so 7 days after they show symptoms. And I think these are realistic numbers. People don't go have themselves checked right away. They usually are sick for a while, and when things get worse, they go to the hospital or they go to a doctor, they get tested, and that's when they find out that they have the coronavirus. So with this assumption, it seems to have a reasonable fit between the model and the data. Here we see the number of active cases, so the people who have the coronavirus and who haven't either gotten better or died yet. And so what we see here is that the peak of the number of active cases is a little higher than what the model predicts. Probably that is because the quality of the data get better over time, and so there's probably a little more reporting by the time of the peak than there was in the beginning. That's probably the reason why the model, the blue curve, does not fully describe the data well. So that is kind of a calibration phase. We're using data of China because we have a pretty good idea of what happens after the intervention. Now, when we look at the data of the whole world outside of China, then things get a little more complicated because we're actually not far enough into the spread of and the containment of the disease to really know what is going to happen. So we're going to assume that something similar happens to what happened in China, and that we can apply that to the whole world. It is assumed here. I obtained a good fit between the data of the number of deaths as a function of time when I assume an R0 of 3, which is slightly higher than I'd used in the original model. In the original model, I assumed that the R0 was 2.8, so I think 3 is probably a little more accurate. And it is assumed here that some countries do an intervention, some countries don't, but on average, the countries do interventions with an efficiency of about 72%, leading to an R0 of 0.85. And this is done by running a bunch of simulations and comparing them to the actual mortality data and see which combination of parameters gives me the best fit. So it was assumed that on average the interventions start on March 16, which I think is a reasonable date. Some countries started sooner, some countries started later. I think that's a pretty good average. So when we look at the comparison between the data and the model, we get the chart over here. We see the orange here is the reported mortality data up to April 1st. On April 1st, this is the data for the world outside of China. So we're at almost 50,000. And if we extrapolate from there, we get this. So we see the disease is going to run its course, the epidemic is going to run its course for the rest of the year. By the end of the year, will that be approximately 380,000 deaths. That is the base case simulation, and that is the simulation that I believe best fits the data that we have so far. On log scale, it looks something like this. Again, we see by the end of the year, the curve is very flat and not a lot of new cases, and that's probably the time when we will be able to start loosening the lockdown conditions. I've got some further figures to compare the goodness of fit that I used in my calculations. So that's with the best information that we have right now using the mortality data of the whole world. This is the most likely scenario. Now, as will be clear later on, this is a somewhat optimistic scenario. I'll explain what I mean by that in a bit, but this assumes that every country is doing their fair share to control the virus. If a substantial number of countries don't make sufficient efforts to control the virus, we're going to have a lot more deaths than 380,000, I'm afraid. So it will be interesting to see what can potentially happen, to make sure that people are fully aware of why we need to be very careful with this. Next, here is an estimation of the number of cases as a function of time. Here I had to assume that 1 in 6 coronavirus cases get reported, which is a lot less than the number I had to assume in China. So overall, it seems that the reporting worldwide is not as good as the reporting was in China. I'm assuming that the death rates are relatively accurate, because when things deteriorate to the point where people are in critical conditions, they're usually tested. So usually we know the number of deaths from the coronavirus, but we don't know how many people had only mild symptoms and never got tested. So it makes sense that we need to introduce a ratio to get a good fit between the model and the data. So what that would mean is that instead of the 900,000 cases that have been reported so far, there are actually 5 million people about in the same stage. So that means that they have conditions, they've had symptoms for at least a week. We're probably about 5 million people in that situation. Now it looks like a very good fit, but when you look on log scale, you see here, this is the orange again as the reported data. The blue curve is the model early on. The fit is not so good. To get a good fit early on in the simulation, we need to assume a multiplicator of 2. In other words, early on, about 1 in 2 cases were reported. Later on, as the number of cases increased, that number went down to only about 1 in 6. And I think the reason for that is because originally, in the early stage, the cases were dominated by countries like South Korea, which did very good testing, a lot of testing. So back when most cases were coming out of South Korea, there was a pretty good coverage of the disease by the testing. And so as other countries got more and more infections, countries that were not as strict on the testing, the quality of the data deteriorated. Some countries are now overrun. They they have too many cases, they can't test them all, and so that also leads to the deterioration of the quality of the data. So the number of active data, again assuming that only 1 in 6 cases are really reported, is the model seems to work pretty well. So currently my estimation is that there are about 4 million active cases and about 300,000 maybe seriously ill people. 300,000 to 400,000 is where we are right now, according to the simulation. And here we have an estimation of the real number of cases, including all the cases. That means not just people who have symptoms and who've had symptoms for a week. These are all the cases from the infection onwards. And 1st of April, according to the model calculation, we are probably at about 10 million people who carry the coronavirus or who have carried the coronavirus. In other words, the number of real cases would, according to my simulation, be about 10 times higher than the number of reported cases, which seems realistic. Most people seem to think that the actual value is typically 10 to 20 times as high as the reported number of cases, so that seems to make sense. Here again in log scale, we have the real number of cases, we have the reported number of cases, the yellow line, and then the black line is the number of deaths worldwide outside of China. So that gives you an idea of where we are right now according to the most plausible version of the model. Now, there is a very big uncertainty on those data, and to show how big the uncertainty is, I want to run a couple of scenarios to give you a better idea of what could happen if we are just a little better or a little worse at containing the virus. So the base case is here. I've shown you this data before. After about a year, we're at 380,000 deaths from coronavirus. Here we see the same thing in log scale. This assumes, as I mentioned before, a 72% effectiveness of the intervention, the social distancing. So that means that we are reducing the infection rate by 72% from worldwide average from 0.3 per day to 0.085 approximately. So we're going from an R0 of 3 to an R0 of about 0.85. Now let's assume that we increase the efficiency by 5%, so an efficiency of 77%, or by 10%, so an efficiency of 82%, or if we decrease the efficiency by 5%, so to 67%, or by 10%, so to 62%. Let's see, what does that mean for the number of people who will eventually die of the coronavirus disease? So let's start with increasing the efficiency of social distancing by 5%. Even though we're increasing the efficiency by only 5%, we can reduce the number of deaths from 380,000 to about 210,000. And that shows you how important it is, first of all, that everybody is involved in containing the coronavirus. That's why it's not a good idea to make these measures voluntary, they should be required because everybody needs to follow them, because a small number of people not following the rules can actually lead to a lot of extra deaths. It also means that interventions that are sometimes considered ineffective or not sufficiently effective could actually be very effective. For instance, wearing a face mask. A lot of government officials have said, no, don't wear a face mask because then you're taking them away from the doctors and the nurses. And I fully understand why people are saying that. But come on, we've been at this for several weeks. Governments have had the time to force companies to make more face masks. There should be plenty of face masks by now. If everybody wore a face mask, that would definitely decrease the infection rate by 5%, probably by a lot more than 5%. And that could save 170,000 lives. And I think it's worth it to do that. Here we see this in log scale. Clearly, we can't actually see the difference in the data up to today between the base case and a 5% more efficient rate. So it's hard to tell right now which scenario we're in. We could be in either one of those. Next, let's see what happens if we increase the efficiency of the social distancing measures by 10%. Now the total mortality is about 150,000. So that brings it down by another 60,000. So going from 5% better to 10% better can save another 60,000 lives. Here we see the same thing in log scale. Again, we can't really see which scenario we're in, because until now it's actually too early to tell which scenario we're in. It's going to take a couple more weeks, maybe up to a month, before we really be able to tell which scenario we're in. But we can speculate, right? And it's really important to be as low as possible on this curve. Next, what if we are doing 5% worse than we think? Now this is very dramatic. Instead of 380,000 cases after 15 months, we are talking about 1.8 million deaths by coronavirus in 15 months. So that would lead to almost 1.5 million extra deaths, just if we are a little bit too lax and lose 5% of efficiency in social distancing. This is what it looks like in log scale. Again, we can't really tell from the data we have so far which scenario we're in. Here the R naught is about 0.99, so we're just below 1. So clearly, just hitting 1 is not good enough. We need to do better than 1, like 0.85 in this case, or 0.7 like here. That's kind of the range we need to be in. Next, if we're really relaxing and we get things 10% worse than we think they are, then all of a sudden we're talking about almost 20 million people dying of coronavirus, just if we are 10% less effective than we should be. That really shows you how important it is that we leave nothing to chance, leave no stone unturned, do everything we can to get that number that are not as low as possible is really important. It can make a huge difference in number of lives. This is what it looks like in log scale, and again, you can't really tell which scenario we're in. It's going to take another month before we really can tell. So for now, I'd say my optimistic scenario, realistic, the best realistic scenario right now leads to about 380,000 deaths worldwide of coronavirus. But as soon as a couple of large countries get too lax, that number is going to go up tremendously. It's very important that everybody plays their part in this crisis. So that's it for me. I will continue doing these videos in the next little while. I will start looking at individual countries. I will start with the countries that have been hardest hit by the virus, see how they're doing, see what trajectory they're on, and see if we can learn something from that experience to see kind of project how other countries are doing. We're not as far down the curve yet. And hopefully we can learn from that enough to make sure that we're not making mistakes that other countries have made. There it is. I hope you find the information useful. If you did, please like this video and subscribe to the channel. As I said, I will provide more videos with more specific country specific information in the next couple of weeks. So please look out for that, and I hope to see you again in the next video.